Good morning. Today we will be starting with one of the major topics of gynecology, that is family planning. This topic is important from the theoretical point of view, though the chances of long questions coming is less, but still it can come. And of course, the short notes are a high probability. And of course, it is important from the practical point of view. Anything can be asked from the family planning. So today we'll be dealing with the barrier and natural methods after having an overview of the family planning. This topic has already been dealt in community medicine. This partly will be a repetition of whatever you have learnt earlier. So family planning is utilized to regulate the number and spacing of children in a family through the practice of contraception or other methods of control. So that was from the technical point of view. If you take from the social point of view, family planning is a way of thinking and living that is adopted voluntarily upon the basis of knowledge, attitudes, and responsible decisions by individuals and couples in order to promote the health and welfare of the family group and thus contribute effectively to the social development of a country. So it indirectly affects the social outlook of a state or a country. So contraception is another word which we have to deal with when we are dealing with family planning. Contraception is an intentional prevention of conception through the use of various devices, sexual practices, chemicals, drugs, or surgical procedures. So, any device or act whose purpose is to prevent a woman from becoming pregnant can be considered as a contraceptive. So, what are the benefits of this fertility control? The benefits are there's improved quality of life, better health, less physical and emotional stress of life, better education, and better job and economic opportunities. So these benefits are not only enjoyed by the couple, but they are beneficial for the children, other family members, the community, and the country at large. So though the word contraception and fertility control are used synonymously, they are not synonymous. Fertility control includes both fertility inhibition, that is contraception, as well as fertility stimulation. While the fertility stimulation is related to the problem of the infertile couples, the term contraception includes all measures, temporary or permanent, designed to prevent pregnancy due to the coital act. So that is what we'll be dealing in today and in the subsequent lectures. So these are the various family planning methods. I'll not go into detail today, but some of them, like the barrier and natural methods, will be discussed today, and rest will be discussed subsequently. So what is the purpose of these family planning methods? As we all know, that the raising a child requires significant amount of resources, that is time, social resource, financial and environmental resource. So planning can help assure that resources are available when we are planning for the child. So to improve, and is also it improves the health of the mother and child, and also helps in preventing HIV and AIDS and various other sexually transmitted infections. So what is the scope of family planning? With the family planning, there is proper spacing and limitation of births. One can give advice on sterility. Education for parenthood also can be encouraged, and the screening for pathological conditions related to the reproductive system can be done. Premarital consultation is also included in family planning. so that accordingly they can plan the child. Then the preparation of couples for the arrival of their first child is very important scope of family planning. So objectives of family planning: to avoid unwanted births, to bring about wanted births, to regulate interval between the two pregnancies, to control the time at which births occur in relation to the ages of the parent, and to determine the number of children in the family. These are all the objectives of the family planning. So when we are dealing with family planning, that is mainly it is a contraception and contraceptives which are to be used. And so what are the criteria for ideal contraceptive? The ideal contraceptive should be safe for use, and that means free from any kind of side effects. It should be reliable. It should be easily to administer and convenient for the couple. It should be cost effective, should be culturally feasible and acceptable, should be independent of coitus, should require little or no medical supervision, should be simple to administer, and should be inexpensive and require minimal motivation and maintenance. And it is advisable also that a contraceptive should have some non-hormonal, non-contraceptive benefits. So is there any ideal contraceptive? No contraceptive available as of now fulfills all criteria which we have mentioned in the previous slide. So some are suitable to one group of people and some are suitable to another group of people, and depends upon that what stage the couple are, their age and the number of children they have already got. So people have to choose any one method depending upon their needs, their wishes and their suitability. So we can tell them these are the various contraceptives available. So the couple can choose any of the methods by considering their suitability, can tell them the pros and cons of each method. And so this type of method advising the couple is called as the cafeteria approach. That is, you give all the samples of various contraceptives available and let the couple choose which contraceptive they want to use. Another term when we are dealing with family planning is that it's a failure rate. So to know the effectivity of any contraceptive, we should know what is the percentage that it is liable to fail. So this failure rate, as far as the contraception is concerned, is described in terms of pregnancy rate per 100 women years. That is also known by the term Pearl Index. So if 100 women are there and they're using contraceptive for 1 year, then what is the failure rate of that contraceptive device? So that is how the Pearl Index is calculated. So various contraceptives are demarcated over here, and that's how the arrow goes. These contraceptives are the least effective, and the contraceptive which are shown at the top are the most effective contraceptive. So this is the spermicide, the calendar method and all, the least effective ones. The sterilization, that is tubectomy and vasectomy, are the most effective the contraceptive, along with the implants. So what are the various methods of contraception? It can be spacing methods, like natural methods, then the barrier methods, which can be physical barrier methods, chemical barrier methods, or combination of them. Intrauterine devices, and the hormonal methods varies by various routes, and the post-conceptional and other methods. Then there are some immunological methods which can be used, and suppression of spermatogenesis in males is another method which can be used as contraception. So spacing methods, they are used to postpone or to space births. So these methods help in prevention of pregnancy as long as they are used, and they can help in timing and spacing of pregnancy and thus preventing unwanted children. So these methods are temporary methods. And permanent methods, that is the terminal methods, are vasectomy and tubectomy. So there will be a separate class for terminal methods or the permanent methods. So mode of action of contraceptives. Before we go into mode of action, we should know how the conception occurs. What are the various factors that are required? So one is the normal semen, that is along with the normal sperm quality. Then ovulation should be there for conception to occur. And for fertilization to occur, there should not be any obstacle from the time the ejaculation takes place till the ovum and sperm meet and the fallopian tubes. So if there is any obstruction on the way for the ovum and sperm to meet, then the conception will not occur. So these are the three main factors which determine the conception. So in the contraceptive, take these into consideration, and various contraceptives are used to focus on these factors. So mode of action is, one of them is suppression of ovulation. So this suppression of ovulation occurs at the hypothalamic or pituitary level by hormonal contraception. Then we can do suppression of spermatogenesis by hormones, or prevention of sperm deposition in the vagina by use of condoms or any other method, or through vasectomy. Then one can prevent the union of the ovum and the sperm by producing a block somewhere in the tract, or ligation of the tube, or ligation of the vas. So interfering with the tubal motility or ovum transport by intrauterine devices or hormones. Then preventing the implantation of fertilized ovum by causing changes in the endometrium by intrauterine devices or oral pills. Then preventing the sperm migration through the cervix by increasing the viscosity of the cervical mucus by hormonal contraception. And luteolysis of the corpus luteum of the ovary by antiprogesterone. And one can do disruption of the early zygote by immunological or other means by anti-fertility vaccine. So these are the various modes of action of contraceptives which are used directing for the various factors which cause conception. So another term which we should deal with when we are dealing with contraception is medical eligibility criteria. So these are a set of guidelines published by World Health Organization which helps in decision making as to the sustainability of a particular method to the individual. So they have got various categories from 1 to 4, and so that determines whether this particular contraceptive should be used in a particular couple. So the category 1 includes those which can be used in any circumstance, and category 2 is generally can be used. So these two categories, that is 1 and 2, are one can use. Category 3 includes the method not usually recommended unless other more appropriate methods are not available or not acceptable, and category 4 is methods not to be used. So category 3 and 4, one should not use these methods. Again, explaining the same thing. So while category 1 indicates that the method is suitable for all, category 4 indicates that it is not suitable. Categories 2 and 3, which fall in between, indicate relative contraindications to their use. So category 2 indicates that the methods can generally be used, but careful follow-up is required, whereas category 3 indicates that the method is best avoided unless no other method is available. So whenever we are prescribing these contraceptive methods, this has to be taken into consideration. So now coming to the natural methods, that is natural family planning methods, are also called as NPF. It's a method of planning or preventing of pregnancy by observation of natural symptoms or signs of fertile or infertile phase of menstrual cycle. So this is mainly practiced with abstinence during fertile period without using any drugs or device. So here no drug or device is used, so no money is spent, so privacy of the couple is maintained, and there are no side effects because we are not using any act or any device by which the side effect can occur, or any drug we are not using. And here the only thing is so no side effects, and as cooperation of husband is required, it improves the marital relationship between them also, and can be used by women of any constitution, whether they are thin or obese, so can be used because it's not going to cause any side effect. So this can be abstinence during the fertile period, or another is your coital technique, that is by withdrawal method, also called as coitus interruptus method. So one of the oldest methods of the family or natural methods of contraception, which will be coming to later. So natural methods, what can be the merits of natural methods? As we have already told, it doesn't involve any cost. It doesn't require any other device, and with self-control and discipline, it can be fairly effective. The demerits include it requires a great deal of motivation and self-control by the couple, mainly the male partner, if it is withdrawal techniques is being used. And the failure rate is quite high. It goes above 6 and sometimes even maybe more. And slightest delay in withdrawal, if you're using withdrawal techniques, can lead to pregnancy. So there are various advantages of disadvantages of these natural methods. So the failure rate is quite high. So the couple should know that the failure is quite high, and then accordingly they can decide about choosing this method. So it has got adverse psychological effects on both the partners if they are using the withdrawal technique, especially the male partner. So when we are dealing with the abstinence during infertile period, the safe period, the term safe period comes into play. So this safe period is based upon the process of ovulation and menstrual cycle, which helps in determination of the safe period when coitus can be done and unsafe period when coitus is to be avoided to prevent pregnancy. So what are the merits? It doesn't require any man-made device. However, there are many demerits, that because it requires self-control by the partners during highly unsafe period and not suitable for the women who do not have regular menstrual periods. Failure rate is quite high, and it requires a great deal of willpower and motivation by both partners. So this is how we see the safe period. So this is the one when the menstruation has occurred, and this is the period just after the menstruation, which is a safe period, and this is around the ovulation, when it is the unsafe period, when the coitus should not be done, and thereafter till the menstruation ensues, this is the period one can do the intercourse. Here also this is the menstruation till here, and after that this is unsafe period over here, and this is again the safe period till the menstruation ensues. So natural family planning methods when we are dealing with the calculation of the safe period or unsafe period is, one can use rhythm methods or the calendar method, and the basal body temperature method, standard day method, cervical method, symptothermal method, lactational amenorrhea method, not exactly the one for this thing, but it is a natural family planning method, and commercial ovulation detection, do-it-yourself method, which can determine when the safe period is likely. So the term fertility awareness method is a natural family planning strategy that women can use to help prevent pregnancy. It involves tracking of one's natural cycle of fertility and menstrual cycle developing a better awareness of the body, and using a variety of non-pharmaceutical methods to detect ovulation. So that is what the woman comes to know about the fertility awareness, when she is likely to be fertile and when it is safe to have sexual intercourse. So rhythm method is most commonly used. This is the avoidance of sexual intercourse during the fertile phase of the cycle, also called as periodic abstinence, or like we said, safe period. So as we all know that the ovulation occurs 14 plus minus 2 days before the next period. Usually the second half of the period, that is the secretory phase, is more or less constant, and the proliferative phase or the initial phase of the menstrual cycle alters. So the safe period, according to the Ogino-Canis theory, depends on the length of the cycle. An ovum can be fertilized within 24 hours of ovulation, and a sperm can fertilize ovum within 3 days as per the WHO. So this thing, natural flannery method, is based on the assumption that if coitus can be avoided during the fertile or unsafe period, there will be no conception. This is the safe period is one of the only methods approved by the Roman Catholic Church, and no other methods is advisable or permitted. So usually what happens, the ovum itself may live, like we said, it can be 12 to 24 hours. So the intercourse between 11th and 17th day may result in pregnancy if it is a regular 28-day cycle. Now, however, there can be slight variation of the menstrual cycle. So if it is a 28 plus minus 2 days cycle, the safe period days are menstrual flow. We assume it is 4 to 6 days. Then 3 days after the period and 9 days before the period. That is the calculation for the 28 plus minus 2 days cycle. So if the period is short, that is less than 28 days, the safe period days are less, and if it is longer than 28 days, the safe period days are going to be more. So more days are available for intercourse if it is a longer period. So to be accurate in calculation, a record of 6 previous cycles are advisable, and the longest and the shortest cycles are to be noted. And by subtracting 18, some people take it as 21, from a shortest period, she can know her first day of her fertile period. And by subtracting 11 from the longest period, she can calculate the last fertile day. So suppose this 26 is the shortest day cycle, and the same 32 days are the longest cycle. So if we subtract 26 minus 18, then it becomes 8. So 8 is the first fertile day if it is a shorter cycle, is a 26-day cycle, and longest cycle being 32. 32 minus 11 becomes 21. So that 21 is the last fertile day. So if the woman has got 26 to 32 day cycle, so the unsafe period will be from day 8 to day 21. So at that time, no sexual intercourse can be done. So this method, that is the rhythm method, is not applicable in irregular cycles, and at times what happens when with the sexual intercourse itself, the ovulation can occur in between. So failure rate is 10 per 100 women years, but if the fertile period is not strictly followed, then the pregnancy rate increases. So alternative to this is to calculate the risk period, which is from 3 days before ovulation to 3 days after ovulation. So another method is Persona. It's a microprocessor attached to a microlaboratory. This measures the levels of estrone 3-glucuronide and luteinizing hormone in the morning urine by dipping a test stick in the urine. If the green light shows conception, this should be shows, then the conception is unlikely, and if it shows red light, and then it indicates fertile period and warns the probable ovulation and conception if the sexual intercourse is done. So failure rate with this method is approximately 6 per 100 women years. So another method in determining the safe period is MUCUS method, also known as Billings or ovulation method. So as we know, properties of cervical mucus change under the influence of the ovarian hormones on different days of the cycle. So the woman attempts to predict the fertile period by feeling the type of the cervical mucus she has. So under the influence of estrogen, usually the mucus, that is the cervical mucus, increases in quantity and becomes progressively more slippery and elastic until a peak is reached. Thereafter, the mucus becomes thicker, scanty and dry. So intercourse is considered as safe during the dry days, that is immediately after the periods, until the mucus is detected. Once the mucus is detected, it is unsafe. So, thereafter, the couple must abstain until the 4th day after the peak day of this mucus secretion, when it becomes drier, when it becomes thicker, scanty, and dry. So this change in the from the slippery one, the thinner one, to the sticky one, the thicker one, is under the influence of progesterone, and this continues until the onset of the period. So somebody has tried a modified mucus method, but this has not been found to be superior to the Billing method, which has been described till now. Failure rate is said to be 3 pregnancies per 100 women years, which is quite good. So another method by which we can find out the safe period is basal body temperature. So this is how the temperature is charted. So usually after ovulation, the progesterone level rises, and this increases the temperature to 0.5 to 0.8 degrees Fahrenheit, or if it is in centigrade, it is 0.2 to 0.4 degrees centigrade of the body temperature. Then there may be sometimes a visible drop by 0.2 degrees Fahrenheit before this, right? Like there's a drop over here, and then there is a rise. So every day the woman records her oral temperature, keeping the thermometer for 3 to 5 minutes under the tongue as soon as she gets up in the morning and before coming out of the bed, or taking any fluid and before washing. So immediately after she gets up, she has to take the oral temperature. So then there are special thermometers are available with 36 to 38 degree marking, which are easier to read, because here we have to see the rise in less than 1 degrees Fahrenheit. So then it should be more markings in the thermometer should be there to know that how much is the exact rise of temperature in this thing. After there's a drop in this thing. That means your progesterone effect is taking place. So because all these methods are sometimes not that accurate, then the combination of method can be utilized, which is known as the SYMPTOTHERMAL method, which is more effective than the individually. So first days of abstinence in this method is predicted either from the calendar, that is subtracting 18 or 21 from the shortest cycle, or the first day of the mucus is detected, that is when the first day of the fertile period starts. And the end of the fertile period is predicted by the use of the basal body temperature chart, which we have just discussed. So the woman resumes intercourse 3 days after the thermal shift. So this is indicating the first day of the fertile period. This is indicating the last day of the fertile period. And after 3 days of that, then one can assume the intercourse. So another method is standard days method, also called as SDM. It's highly effective, inexpensive, and modern family planning method that is easy to teach and use. Identifies a fixed fertile window in a woman's menstrual cycle when pregnancy is most likely. Cycle beats as a visual tools is used in this, which helps women to track their cycles to know when they are fertile. This is the standard days method, identifies 8 to 19 day of the cycle as fertile and for women who have got 26 to 32 days cycle, like we are used in the calendar method, and helps a couple to avoid unplanned pregnancy by knowing which days they should not have unprotected sex. So here, see that on day 1, the first day of the monthly bleeding, move the rubber ring to the red bead. Then the next day, move the ring to the next bead, and this is done every day, even with the bleeding days. And white bead days are the days when the woman can become pregnant. So she should avoid unprotected sex over here. Then the brown bead days, this and this, are the days when pregnancy is unlikely and she can have unprotected sex. So another method is a withdrawal method, also called as coitus interruptus. It's a common practice among some married couples, and our coitus takes place in a normal manner in this instance, but the penis is withdrawn immediately just before the ejaculation. So the ejaculate, that the semen is then directed away from the vagina and it comes outside the vagina in an effort to avoid insemination. So that is, the sperms are not going into the vagina and thus preventing conception. So since the penis is withdrawn and ejaculation takes place outside the vagina, this method is called coitus interruptus or withdrawal method. So the unreliability of this method is obvious by the description we had just now, and failure rate is approximately 25 pregnancies per 100 women years. And the main cause of failure, if the method has been adopted properly, is that prostatic fluid secreted prior to the ejaculation frequently contains spermatozoa. That is how the conception can occur, and the high failure rate is there. But usually this thing, though it is mentally it is very disturbing, but some couples seem to prefer this method and make no complaints of suffering from strain and anxiety. So advantages of this method is that there is no cost, no contraindication, no systemic side effects, no effect on lactation, and no need to visit a health person. However, disadvantage that the failure rate is quite high. It requires strong motivation, especially from the male partner, and then there is no protection against HIV and sexually transmitted infections. So other coital techniques which can be used are coitus intercrucis, that is performed in between the thighs of the female, and the coitus reservatus, that is, there is no movement during the act, so hence ejaculation doesn't occur. Then the coitus sexonicus acts continues till the ejaculation, and then the male perineum is stoked. By this action, what happens, the sperms, instead of coming out, they go into the urinary bladder, and thus conception doesn't occur. And then there is the extragenital sex, oral and anal sex. If they are utilized, then again the conception will not occur. One of the other natural methods of contraception is lactational method or breastfeeding. If there is a prolonged and exclusive, that is 6 months breastfeeding is done, this offers a natural protection against pregnancy, especially in the early days after delivery. So the criteria for successful lactational amenorrhea method are continuous amenorrhea and exclusive breastfeeding after 6 months, and night nursing is usually highly protective, and this is more effective in women who are amenorrheic than those who are menstruating. So apart from the beneficial effects of lactation on the newborn, breastfeeding is advocated as a natural method of family planning in the first 6 months after childbirth. That is when it is most effective. However, because here there is no LH surge and no ovulation is occurring because of hyperprolactinemia. However, beyond 6 months of breastfeeding, prolactin level falls and then ovulation can occur. So then this method cannot be applied on its own. Then other methods of contraception also have to be used conjointly. So it has been seen that it is the frequency rather than the duration of breastfeeding that decides an ovulation in the mother and whether one can use this as a contraceptive method.